Okay, so you guys choosing option D, which says that the infectious dose of hemorrhagic fever viruses appear to be low. Okay. Okay. Yeah, that makes sense because so option D is the most likely answer. Every other thing there doesn't make sense. Humans cannot be the reservoir for something that kills humans. Ebola virus belongs to the family of what? We have Arena, Philo, Flavi, Bunya. I'm going to teach you my mnemonic. Do you know anyone called Philomena? You're about to learn Philomena. Marburg, Ebola, and norovirus or one of those other viruses. Okay. So once you think of these three viruses, think of Philomena. All right. Which of these transmits Rift Valley fever? You have the bats, mosquito, rodent, tick. You have to know that there are many. You have to know each of these things mentioned here and what they likely transmit. Like bats, what does bats transmit? Bats is also involved in uh, Lassa fever. Same way rodents can be involved in Lassa fever. Okay. Mosquito transmit a lot of things. It's not only malaria. It's not only malaria that mosquitoes transmit. So apart from malaria, depending on even on the type of mosquito, so is it there's Culex, there's Aedes aegypti, which are involved in yellow fever, and some of these other types of viruses, Rift Valley, Mediterranean, all those similar viruses. Then we have the female Anopheles that is particularly penchant for malaria and all that, Plasmodium. So that's that. Psychosocial hazards include
Chief, please. Sorry, I came late. What's the answer for number 1 and number 2, sir?
They're taking us back. Number
Sorry,
1
sir.
is B. Number 2 is B.
Number 1 is A.
Number 1 is D. Option D, as in dog. B is
Okay.
boy. Option 2
Okay.
is number 2 is boy. Number
Okay.
3 is boy.
Number
Two.
3.
It's
Okay.
poor.
Number 4.
It's just been posted. People should answer.
Oh, okay. Thank you, sir.
All right.
Okay, I'm coming.
Okay. Psychosocial hazards. You say is none of the above. It's all of the above. Which is not a recognized feature of disorder of high altitude. Retinopathy, pulmonary edema, um, cerebral edema, embolic episodes. Let's attempt the question now so that we can move. Embolic episodes. The other things could happen, but it's not usually a cause of embolic events. You need to have, like, it has to be a thromboembolic event to now cause embolic event. Uh, Hemodynamic, hormonal, and metabolic effects of the scorpion sting can be well antagonized by a single medication like amiodarone, lidocaine, beta blockers, etc. Okay, let's ask everybody. let's proceed, Bob. The answer is processing.
Yeah? Third answer is what?
Prazosin is a one blocker, just like tamsulosin and some other medications. So it's expected to antagonize the. Mute your mics, please. I don't like the echo. So it's expected to antagonize the sympathetic discharge that follows scorpion sting. Lidocaine can be used, but it's usually used locally. Okay, but prazosin, because it's can be given orally and otherwise. Okay, so it means it can actually affect the hemodynamics and the hormonal changes and metabolism. Lidocaine is used locally on the area of the bite. I've gone this question before. You guys should be answering questions sharp sharp so that mercury poisoning, if you don't know it, you guess. That's how you learn. You don't learn passively, you learn actively. If you guess, you get it wrong, your brain tells you that this is now the correct answer. You learn more than if you're just looking. Sudden death as a result of. Okay, have I posted it? Okay, this is another one. In mercury poisoning, death is usually due to HCC, shock, renal failure, encephalopathy. Yeah, you guessed. Well, it's due to encephalopathy. Can basically cause many of these things there, but it's the brain this thing that will kill the person.
The encephalopathies.
Sudden death as a result of severe electric shock is commonly due to circulatory collapse, ventricular fib, hypovolemic shock, acute renal failure. Of course, because the The heart emits electrical impulses via the SNO. That's what drives cardiac activity and cardiac pumping. So during an electric shock, it means it's going to reset the entire electric. And in fact, we use electric shocks too, but not in the conventional way. We use electric shocks called defibrillation, right, or cardioversion to resuscitate a patient maybe that is having ventricular fibrillation or any form of arrhythmias. Okay, so um, that's why it's important to consider the electrical activities of the heart. Anything that affects it can lead to type of any type of arrhythmias. That's what happens in electric shock. So, which of these is the most serious adverse effect of heat? We've answered this question before. Okay, so the last time we mentioned it was heat stroke. Moderate hypothermia, how do you classify it? Let me put it in context for you. How to classify hypothermia into mild, moderate, severe. So you can see that the mild one is going from 32 to 35, moderate from 28 to 32, severe below 28. Okay, and the mild one will lead to shivering, some confusion. Moderate one will lead to stupor, lots of shivering, and severe one will lead to unconsciousness and ventricular fibrillation risk. Okay, so it's clear that option A is the answer. This one is um, first year first year medical school question. Which of these can damage arterial endothelium? Smoking, hypertension, elevated cholesterol, aorta and nota. Of course, it's all of the above. When you talk about risk factors for cardiovascular, or just say cardiovascular risk factors, or risk factors for cardiovascular disease, you mentioned the um, modifiable and non-modifiable. Okay, that's basically how you classify it. So, whenever someone asks you what's the cardiovascular risk factors or risk factors for cardiovascular diseases in general, be it hypertension, strokes, myocardial infarction, acute coronary syndrome, any form of peripheral arterial disease, any form of cardiovascular event, okay, classify into modifiable and then non-modifiable. So the modifiable ones are things like this smoking, hypertension, which you can control, right? Uh-huh. Smoking, hypertension, diabetes, alcohol, overweight or obesity, things like that. Yeah, they are modifiable. Then the non-modifiable ones are things that you cannot control, like age, sex, the male sex, okay. What else? Race, black race, okay, and things like that. So, um, genetics, family history, you cannot control those things. So those are the non-modifiable risk factors. So whenever you're asked a question in medicine, the first thing you should ask yourself is there a way to classify this question? If you are able to identify the correct classification, you've done 50% of the job. The rest of the work is just to fit it into the classification that you've created. So always look for that. It simplifies your work. The next question says all but one is included in pathogenesis of this disease, atherosclerosis. White blood cells attach to adhesion molecules on the endothelium. Free radicals produced by cholesterol reduce LDL. White blood cells move by diapedesis out of the bloodstream. LDL moves to the tunica intima of the artery. Macrophages engulf the liquefied or the modified LDL, forming the foam cells. So which one is off from here? The pathogenesis of atherosclerosis. free radicals will oxidize LDL, okay, and uh, this is part of the pathogenesis of this disease, okay. Actually, white blood cells will move out, and you know what diapedesis is? Just like a kind of crawling, and so they will develop pedia or podia, as it's called, and use it to squeeze through in between and get to the place where the inflammation is happening. So they actually carry out diapedesis, and that's the option B is the answer. Bladder cancers can be caused by toluidine. These are people's names, okay? There's Tolu, there's Fina, there's Ben. So all these people, they cause bladder cancer. Yeah, of course, it's all of the above. Both Tolu, Fina, and Ben, they all cause bladder cancer. Tolu, Fina, and Ben, they cause bladder cancer, okay? Cerebral syndrome after radiation does not include, which is the odd man out. Okay, blindness is the odd man out. Can cause all these things, but blindness is not like one of the regarded cerebral syndrome. Please don't move anything, Dr. N. Which is false in heat exhaustion. Don't move that thing you're holding, Dr. N. If you move it, I'll remove you. Which is false in heat exhaustion. Skin is cold and clammy. BP is poor. Pulse pressure is elevated. Constricted pupils. In heat exhaustion, the pupils are usually dilated rather than constricted. Okay, so all these other features are there except pupillary constriction because we expect the pupils to be dilated. It's like a form of shock. Person has gone into shock, so skin is cold and clammy, BP is low, pulse pressure is elevated, pupils are dilated, not constricted, like sympathetic discharge in response to the exhaustion. Um, Sudden death as a result of severe electric shock is common. Okay, we've answered this one. We just answered this question now.
Okay. Thank you.
Please, the people that were here should correct them. The answer is B. Heart. The heart works with electricity, so just think of it like that. So if you deliver electric shock, it's the heart that is affected because of the SA node, okay, and the AV node and the Purkinje fibers. So you expect it to affect the heart first. Which of these is false concerning atherosclerosis? It's a type of atherosclerosis is a type of arteriosclerosis. Atherosclerosis can lead to MI. Progression of atherosclerosis starts with damage to the endothelial wall. Atherosclerosis is serious condition where large veins are narrowed by buildup of plaques. The answer is already obvious. Heat stroke is the most serious form of heat-related illness. It's a medical emergency that can cause damage to the brain and other vital organs and can be fatal if not treated promptly. Heat exhaustion is less severe but can lead to heat stroke. Then heat cramps, heat rash, they're like milder forms of heat-related issues. They are not life-threatening. So it's like a progression from heat cramps, heat rash, heat exhaustion, and then heat stroke, the final straw. Of course, option D. Atherosclerosis primarily involves the arteries, not um, veins. Concerning atherosclerosis, which is false, it's an acute illness, begins with a fatty streak in the internal layer of the artery, causes narrowing of the arteries can be caused by the position of fat in the innermost layer of the endothelium. The answer is already obvious. Yeah, it can never be an acute illness because it takes time, going up to 20 years, 15 years for these plaques to build up. And after they build up, you know, it has to get to a critical narrowing, see up to 70%, critical narrowing before like causes an event. Then sometimes too is when it ruptures that it also causes an event. So it stays a very long time. The calm before the storm. Concerning Macad, if you remember, we discussed GSDs before, and we said to use the mnemonic BP calm. Okay, so based on this mnemonic, you already know where each one belongs. Which is true. And I told you C to D, A to B, M to M. Uh, so that you have to cram it. So which one is correct? Yes, your answer now. Yeah, all of the above makes sense because it will affect this. The meaning of this M is a muscle phosphorylase. Mercados affects muscle, so that's muscle phosphorylase. H affects hepatic phosphorylase. H for H. Okay, that's number 6. So, and we know that muscles are involved in physical activity, so it will cause weakness and things like that. Um, it's type 5 and it's muscle cramps to it. So it's all of the above. That makes sense. Concerning pyruvate dehydrogenase deficiency, which is false. Inheritance can be X-linked, results in decreased levels of pyruvate. Clinical manifestations include CNS malformations. There's elevated lactic acid levels. to actually lead to an increase in the levels. If you block an enzyme that's supposed to affect something's metabolism, what will happen? That stuff, that substance will now become increased. So that makes sense. So it's supposed to be the process of glycolysis. You're supposed to produce um, you're supposed to produce pyruvate, okay, and pyruvate is supposed to lead to lactates, okay. Pyruvate will also go back through acetyl CoA back into the citric acid cycle and all that. So if you block this enzyme, you block this thing here, what do you have? You start having accumulation of this reaction is reversible. So if you block this enzyme, you start having accumulation of this one here, pyruvate, and also you start having accumulation of this one here too, lactate. So and then having a shortage of the citric acid cycle because you cannot go into it.
So which answer is correct?
Concerning pyruvate kinase,
Four.
its deficiency can cause congenital spherocytohemolytic anemia. It catalyzes the conversion of phosphoenol pyruvate to pyruvate. Most patients deficient of the enzyme are anemic or jaundiced. All of the above, none of the above. Okay, it's it's all of the above.
Please, this question concerning driving and competency, I still call it the right answer.
Okay, let me give you some calls. In glycolysis, sorry, this format is casted. So in glycolysis, all are true except glucose phosphatase is a rate limiting step regulated by three-step reaction that are reversible. The enzymes are cytosolic. Insulin regulates the rate of conversion of glucose to glucose phosphatase. I'm going to go and put these questions now in the airbody immediately. Okay. Let us ask everybody. So you have to know the rate limiting steps in glycolysis. Okay, list the rate limiting. We have PFK, that's phosphofructokinase limiting steps. Let me use the voice. In glycolysis, list the rate limiting steps in glycolysis. So we have um, hexokinase, we have phosphofructokinase, and then we have pyruvate kinase. Remember that's one of the questions that we saw earlier. I was asking us a lot about pyruvate kinase. So it's one of the rate limiting steps of glycolysis. It's supposed to convert phosphoenol pyruvate to pyruvate itself. Then phosphofructokinase converts fructose 6 phosphate to fructose 1,6 biphosphonate. That's phosphofructokinase. Then hexokinase, it has another name, okay, depending on where it is. Um, what is another name for hexokinase? Yeah. So yeah, there's an isokine of hexokinase that is called glucokinase. So I think this glucokinase is found only in the liver. Okay. Why hexokinase is found in the red blood cells and some other cells. So I think that's the difference between them. So basically, these are the rate limiting steps of glycolysis. So based on that, option A is the answer. The answer is even in the question because this is the rate limiting step, not this. This one is the enzyme that is found in glycogen storage diseases. I think von Gehrke. This is the enzyme that is affected in von Gehrke. This glucose 6 phosphatase. Von Gehrke. Von Gehrke. All right. Gluconeogenic substrates except A, pyruvate, glycerol, lactic acid, amino acids, propionate. So which of them is not a gluconeogenic? That's a substance that is used for gluconeogenesis. This is biochemistry. West Africa loves biochemistry. National loves more of physiology. Okay, so you need to know that. So which of them is not a substance that is used for gluconeogenesis? That's the meaning of that gluconeogenic substance. There are a lot of metabolisms in glucose metabolism, right? So there's glycolysis, which is breakdown of glucose. There's gluconeogenesis, which is synthesis of new glucose from non-glucose substrates, like the ones listed in the question. There's glycogen glycogenesis, okay, which is like synthesis of glycogen molecules, usually from glucose, as stored as glycogen in the liver. Then there's glycogenolysis, which is like breakdown of glycogen back into glucose, okay, which will now be utilized in the body. Usually, when someone has fasted for a long time or when something is happening, they are fasting. Trying to get the question. Trying to copy the questions. Yeah, I agree. Option A, propionate. Concerning the citric acid cycle, which is true,